Hi, Dr. Kostelnik here with Rooted Behavioral Education. I wanted to talk to you a little bit about specifically my qualifications. I know I've talked in a different video about how I think clinical psychology is really relevant to all vestibular patients because of our expertise in human behavior. But I wanted to talk to you a little bit about how I got to this point. So just in terms of my professional history, I have a bachelor's in psychology, a master's in experimental psychology, and a PhD in clinical psychology. So all told, it's about 10 years of higher education. But specifically, I have a PhD in clinical psychology, but I specialize in health psychology. And what that means is the interplay between psychological illness and medical illness. So the way I specialized in that was in my final years of graduate school. And then in my postdoctoral fellowship, I worked in the primary care setting. So I worked very closely with primary care physicians and did what are called warm handoffs, meaning if a primary care physician thought it was necessary for a patient to see a behavioral health specialist, they would call me in. And it's not just for anxiety and depression, it's actually for a much wider range of concerns because behaviors are related to so many health issues and the maintenance of those health issues, like people changing their diet or checking their blood sugar with diabetes, taking medication for certain things that are hard to treat, like hepatitis C, doing evaluations to determine candidacy for something like weight loss surgery, like gastric bypass or sleeve surgery, pre-transplant evaluation. So people who are waiting for organ transplants, because all of those things require behavioral change and an understanding kind of what you're getting yourself into and what's going to be involved. So that's my professional history. In terms of patient populations I've worked with, the vast majority of my experience has actually been with veterans, which I think is a major blessing because just in terms of serving those who have served, and I'm a military spouse, so I have a special appreciation for that. But veterans present with very complex medical and psychological presentations. And so I think it's one of the best ways to learn and become skilled at complex presentations. And then that's professionally. And then if you're looking personally, I'm a vestibular patient as well. And I've been on my recovery journey for about 4 years now. So I think I'm really, really well equipped with my experience professionally and as a patient to provide you with education. So I hope you'll take a look at my education. I'm really hoping to help you further your recovery. Let me know if you have questions. You can find me online at Rooted Behavioral Education. I'm on Instagram and Facebook at Facebook/ or Instagram / Rooted Behavioral Education. I would love to meet you. All right, take care.